What you need to know about coronavirus, COVID-19. Coronaviruses are usually found among animals, but some coronaviruses have jumped to humans. At the end of 2019, a novel coronavirus was identified as the cause of a cluster of pneumonia cases in Wuhan, a city in the Hubei province of China. It rapidly spread, resulting in an epidemic throughout China, followed by an increasing number of cases in other countries throughout the world. In February 2020, the World Health Organization designated the disease COVID-19, which stands for coronavirus disease in 2019. COVID-19 is a respiratory illness caused by a new virus. Symptoms include fever, coughing, sore throat and shortness of breath. The virus can spread from person to person, but good hygiene can prevent infection. Find out who is at risk and what you should do if you think you have COVID-19. Incubation period. This is when the virus is establishing itself. Viruses work by getting inside the cells your body is made of and then hijacking them. The coronavirus, officially called SARS-CoV-2, can invade your body when you breathe it in, after someone coughs nearby, or you touch a contaminated surface and then your face. It first infects the cells lining your throat, airways, and lungs and turns them into coronavirus factories that spew out huge numbers of new viruses that go on to infect yet more cells. At this early stage, you will not be sick and some people may never develop symptoms. The incubation period, the time between infection and first symptoms appearing, varies widely, but in 5 days on average. Mild disease. This is all most people will experience. COVID-19 is a mild infection for 8 out of 10 people who get it, and the core symptoms are fever and a cough. Body aches, sore throat, and a headache are all possible, but not guaranteed. The fever, and generally feeling groggy, is a result of your immune system responding to the infection. It has recognized the virus as a hostile invader and signals to the rest of the body something is wrong by releasing chemicals called cytokines. This rally the immune system, but also cause body aches, pain, and fever. The coronavirus cough is initially a dry one, you're not bringing stuff up, and this is probably down to irritation of cells as they become infected by the virus. Some people will eventually start coughing up sputum, a thick mucus containing dead lung cells killed by the virus. These symptoms are treated with bed rest, plenty of fluids and paracetamol. You won't need specialist hospital care. This stage lasts about a week, at which point most recover because their immune system has fought off the virus. Severe disease. If the disease progresses, it will be due to the immune system overreacting to the virus. Those chemical signals to the rest of the body cause inflammation, but this needs to be delicately balanced. Too much inflammation can cause collateral damage throughout the body. Inflammation of the lungs is called pneumonia. If it was possible to travel through your mouth down the windpipe and through the tiny tubes in your lungs, you'd eventually end up in tiny little air sacs. This is where oxygen moves into the blood and carbon dioxide moves out, but in pneumonia, the tiny sacs start to fill with water and can eventually cause shortness of breath and difficulty breathing. Some people will need a ventilator to help them breathe. This stage is thought to affect around 14% of people, based on data from China. Critical disease. It is estimated around 6% of cases become critically ill. By this point, the body is starting to fail and there is a real chance of death. The problem is the immune system is now spiraling out of control and causing damage throughout the body. It can lead to septic shock when the blood pressure drops to dangerously low levels and organs stop working properly or fail completely. Acute respiratory distress syndrome caused by widespread inflammation in the lungs stops the body from getting enough oxygen it needs to survive. It can stop the kidneys from cleaning the blood and damage the lining of your intestines. The virus sets up such a huge degree of inflammation that you succumb. It becomes multi-organ failure. And if the immune system cannot get on top of the virus, then it will eventually spread to every corner of the body where it can cause even more damage. Treatment by this stage will be highly invasive and can include ECMO or extracorporeal membrane oxygenation. This is essentially an artificial lung that takes blood out of the body through thick tubes, oxygenates it and pumps it back in. But eventually, the damage can reach fatal levels at which organs can no longer keep the body alive.